All right. Well, welcome everyone, and thank you for joining us this afternoon. We are really excited to talk about racial equity in the child welfare system with Dr. Jessica Pryce. And it's just such a pleasure to have her here with us today. Just before we get started, I want to bring your attention to a few things about Zoom. We know now Zoom's a part of a lot of folks' world, but we just wanted to sort of share some reminders and some important parts of it for those that may not be as familiar. Everyone today is muted, but we would like you to know that we will be doing a Q&A after and we'll be able to unmute you, but that's located at the bottom left-hand side. There's a little microphone. So when we do have the opportunity to add to the conversation, that is where you will unmute yourself. You can share your camera if you'd like. I always like to see folks' faces and see who's joined us today. But if you're not camera ready, you always have the option of stopping the video. Also, if you have any questions or any concerns with your technology, we are here to help support you. Myself and Troy and Anvi are here from Strategies TA today. You'll see our strategies backgrounds. If you have questions, you can always chat us directly, or if you had a comment. We do ask that everyone hold questions until the end, so since we will be having a Q&A part. That way we can sort of organize the questions for Dr. Pryce. Sometimes they can get lost in the chat if you put them in too early. You can also use the reactions. That's always fun. If something resonates, you can do a high five. They've actually added a lot more, so I'm really excited about that. Those are also something that you can do to interact with our webinar today. This webinar today is brought to you by Strategies TA and the generosity of the Office of Child Abuse Prevention. Strategies TA is a collaborative between the Child Abuse Prevention Center and the Children's Bureau of Southern California. We're very fortunate to help support child abuse prevention teams in planning child abuse prevention in their counties. So again, here is the team that will be here to support you today. My name is Lydia Marquez, and I'm the facilitator and also a senior technical assistance specialist. Joining us is the wonderful Troy Nichols from the CAP Center. He is also a senior technical assistant, and also our lovely Anvi Din, who is our event coordinator. Strategies TA is driven by core values, and our work is really grounded in these important essential elements. We are striving to ground our work in collaboration, equity, accountability, community voice, and strength-based. And the reason these core values are so important to us is we want to make sure that we are providing support and grounding our work in collaborative efforts that really look at being accountable, not just to the teams that we support, but the community, making sure that we are listening and also elevating the community voice, as well as highlighting strengths. And above all, we are always doing this work with the mission of making sure that we are supporting equitable systems. One thing I wanted to mention before we start our webinar is that this webinar is really a jump off to our learning exchange cohorts. For those of you who may or may not be familiar with learning exchange cohorts, these are a new service that we are providing through Strategies Technical Assistance. These are going to be somewhat similar to the learning communities that we held before as Strategies 2.0, with a little bit of a different focus. These learning exchange cohorts are member driven, so members will determine how deep topics will go. There'll also be a time for peers to network, to gather together, to share ideas. But also, it is an opportunity for learning that will allow folks who are doing child abuse prevention work their knowledge and practice. So we launched a survey from our initial strategies TA launch webinar and selected the top 5 areas that will allow the members to delve deeper into these topic areas. Those topic areas are rural communities, COVID-19, building community resilience and community engagement, so that's one cohort together, and of course, equity. This webinar is part of the Equity Learning Exchange cohorts. So before we get started, I just wanted to have everyone share and hold this reflection. How can we be accountable for equity in our systems? So really looking, keeping that question in your mind as Dr. Pryce talks about racial equity.
That they get increments of 10 and they almost...
So today's presenter is Dr. Jessica Pryce. Dr. Pryce is an assistant professor at Florida State University and currently the executive director of the Florida Institute for Child Welfare. For the past 10 years, she has been involved at multiple angles of child welfare, direct practice, teaching, training, policy, and research. She has published on child welfare related topics such as training and education, racial disparity, and anti-poverty practices. She has presented 40 plus virtual and in-person conferences, both nationally and internationally. She is the author of several op-eds focused on racial disparity and effective strategies to impact racial disproportionality within child welfare. Her TED Talk on implicit racial bias in decision-making has since been viewed over 1.3 million times. Dr. Pryce has worked on the front lines of child welfare, conducted primary research, been a policy advisor at Florida's legislature, and taught graduate level courses in child welfare. Previously holding the positions of child protective caseworker with the Department of Children and Families and the deputy director of the University of Albany's New York State Education Consortium. In 2019, she received a 5-year appointment to the advisory board of the National Child Welfare Workforce Institute, where she consults and advises on leadership and workforce interventions around the country. She currently sits on the Florida Dependency Court Improvement Panel alongside judges and advocates who are working towards a more trauma-informed approach within the judicial system. She's maintained and cultivated a commitment to the well-being of vulnerable children and families, the sustainability of the child welfare workforce, and effectively addressing inequity. Her paramount goal includes rebuilding and leading a child welfare system that focuses on strengthening families instead of pulling them apart. We are so honored to have Dr. Jessica Pryce with us today, and we look forward to her presentation. Oops.
Thank you so much, Lydia. And thank everyone for hanging in there through that very long bio. So thank you very much. I actually don't remember how much time I have, but if I go over time, Lydia, just shoot me a chat to let me know. I have lots of information I would love to share, but I would love to leave some time at the end in case you have any questions for me or have some reflections and things that are coming up for you with the material that I have today. So let me start by saying that I will come to this conversation from a child protective service lens, because that's the area where I started my career and that's where I do my research. But it can't be overstated that we will not be able to build an anti-racist system of care without each of you on board. So today we'll talk about power and privilege. We'll talk about how our individual mindsets and our organizational mindsets impact the families we work with, impact the advocacy that we do, impact the policy analysis that we do. And I'll also take us through some anti-racism definitions. And I have some tips and some strategies that you could use to engage in courageous conversations that move the needle on change. I do have a poll or maybe two. So if you have your cell phone with you, keep that handy, because I'll be switching gears over to a different screen and you'll be sending in your responses via your mobile device. Okay, so hopefully everyone can see that. I'm going to do a short segment on history and policy. I won't take you through a semester-long history and policy course like I do with my students, but I'm going to try to do a crash course in history and the evolution of child welfare, just to set the stage. So we know the 13th Amendment abolished slavery in the United States of America, and this was profound and a huge change for our country. But it's also important to know that right after that, there were Black codes and Black laws that only applied to Black Americans. Things that were seemingly innocuous, like we would call homelessness during that time. They usually used the term pauperism. If you were a pauper and African American, you were immediately apprehended and placed in an incarceration. So I became curious during this era when I started working on my doctorate degree, what was happening to Black kids during this era, during the Jim Crow era. And we know Jim Crow was separate but equal, legalized discrimination. So I started to dig deep and research and read, and that's where I learned about the inception of child welfare and when it was built and who it was really built for. What illuminated for me through my time studying that was this dual track delivery system, where if a Black child and their family did have needs and were struggling through some level of crisis, they went through a different type of system, because the system that was created, the traditional child welfare system, didn't allow for, as they called it, Negro children. So this is where the dual track delivery system started, and then disparate outcomes began, because the services and treatment centers and things in general related to child welfare were inferior if they weren't a part of the traditional system. So we know about that big piece of policy, the Social Security Act of 1935. I want to read a quote that came about right before that was enacted in 1930 at a White House conference. This was read at a special committee about child welfare and race. It says, the dependent and neglected Negro children, Mexican and Indian families present unique problems needing special consideration. And while there's theoretical agreement among leaders in health and social welfare that the children of these groups should receive the same standards of care as other children, their needs are in reality little understood by the general public. And in many communities, they're almost completely ignored. This was 90 years ago. I read this quote 10 years ago, and it really stopped me in my tracks, because I knew then, and I know today, that this is still true in many municipalities around our country. The needs of minority children are in reality little understood by our human service sector, and in some areas, they're being completely ignored. So I offer this up along with some history to hopefully motivate you as well as it motivates me, that 10 years from now, 20 years from now, 90 years from now, this will not be the reality for our country and our kids. So that lends itself to a conversation about what is our role in child welfare, or whatever respective organizations you work with, what is your role? I'll read this quote from a book. And I read this quote in 2015, and it says, the major role of the child welfare system is to ensure the safety, permanency, and well-being of children and youth whose families are not meeting those needs. I had some issue with this quote, mainly around the word ensure. It feels very much like the onus is on child protective services, and I'm more community oriented than that. And these last few words, not meeting those needs, this really strikes a chord because of that conflation of neglect and poverty. And people often, commingle families that are in poverty and insinuate that parents are not doing a good job. So not meeting those needs, I didn't like that terminology. I decided to rewrite the role of child welfare. And I encourage you to think through what your mission and vision and role is, and make sure that it intends to include the community and that it's inclusive of the family. I rewrote it last year, and it says, the major role of the child welfare system is to build strategy with strong communities and to partner with vulnerable families, co-creating a safe, well, and stable home environment. Again, just consider what role you were taught to play in your job and what role you have been playing and how effective it's been to equity and better outcomes for children and families. Let's have a conversation about policy. And some of these policies will sound very familiar to you. So I'll try to be as quick as I can. So the Aid to Dependent Children, also known as ADC, and this later became the Aid to Families with Dependent Children. And this was to help those that were struggling with financial need. But there were a lot of morality clauses and suitability requirements. The federal government wasn't very clear on what it meant to be a suitable home. And we know when they're not clear on that, states have discretionary power to decide who gets ADC services and who doesn't. And after you started to track who got the services and who didn't, it became pretty clear that if you were African-American, unwed with children, you were likely to be declined services. And if you were given services, you were given them for a limited time. Something happened in 1960 that really was jarring. If you look it up, it's called the Louisiana Incident. In 1960, there were 23,000 families dismissed from ADC and AFDC based on discretionary power, based on the fact that they didn't have a suitable home. And then came the Fleming Rule. The Fleming Rule was named after Arthur Fleming, who was the Secretary of the Department of Health and Human Services. He was shocked and appalled. He said, we can't just arbitrarily delete families who are in need from getting services through ADC. So he created the Fleming Rule, which had two components. The first component was if a family is not living in a suitable home, we need to send provisions to make the home suitable. But the second component said, if the home continues to be unsuitable, take the child out of the home and place them elsewhere, and then send provisions with that child. The Fleming Rule was created to try to help and mitigate the arbitrary dismissal of folks off of this service. But it really became the cornerstone of our child welfare system because today, that's pretty similar to what we do. We don't use the term suitable, but we have made it common practice to take a child out of their home and wrap around services in their foster home. And now we're trying to reorient ourselves to reinvesting in communities and strengthening biological families whenever that is possible. The next policy I'd like to talk about is TANF, and we all are familiar with this. It's really came with this idea of incentivizing working because folks thought ADC decentivized employment. So TANF said you can get services and help from us, but you have to have a job within a certain amount of time, and you can only receive services for a number of years. Nothing inherently wrong with TANF having these stipulations, but it's also important to consider the wage gaps and the availability of jobs and things of that nature. So as folks were making these policies, it's important to consider a comprehensive understanding of what was happening for families during that time. Next, let's talk about the Child Abuse Prevention and Treatment Act, also known as CAPTA of 1974. So TANF and ADC and AFDC were really about families struggling with material need and needing financial help. But CAPTA came along because
Elizabeth, so iBiology's job posting came up and I was familiar with the org.
Folks needed help with definitions, and folks also needed to understand if we saw that there was abuse happening, how do we call in? So abuse registries were created, definitions of abuse, and also risk assessments. But as you might imagine, now that we have a way for folks to call in abuse reports and we have definitions and things like that, kids flooded our system. So now that we have lots of kids in foster care, now we're going to skip over to the Adoption and Safe Families Act of 1997. This is not an exhaustive list of child welfare policy, but I am giving you some high-level understanding of how policies have evolved. ASFA came along with very good intentions to get all of the kids that we had brought in our system into a permanent placement, but it also created a pathway to terminating the parental rights, legally severing the tie between a parent and their child. So again, that was a little bit of a policy lesson And now we're going to talk about how policies have evolved and what that really means. Evolution versus revolution. As I'm talking through this segment, I want you to consider where you work and what you've been working on and what you've been trying to do as far as change efforts, and ask yourself, is it evolutionary or is it revolutionary? As we know, evolutionary change is inevitable. It's expected and incremental. Organizational evolution is a normal progression. For example, over time, diversity has become prioritized. People have hired HR reps. You might have heard your organization saying, we need to bring in a more diverse workforce. That's evolutionary, because we know that to be revolutionary, we also consider addressing microaggressions and making sure our climate is not just diverse, but racially inclusive. Evolutionary change usually happens to ensure the survival of an organization. But on the contrary, revolutionary change is profound, fundamental, transformational. It's not expected. I tell folks that evolutionary change is normal and natural, but also neutral. Revolutionary change is not neutral. It is usually a complete overhaul and reconstruction, a reshaping, a realigning of strategic goals and your mission. So consider now, what types of evolutionary change efforts have you witnessed, have you been a part of? Because evolutionary change, it does tweak the system. It does make things a little better, but it doesn't make it profoundly different, and it doesn't sustainably impact outcomes for vulnerable families. So this next slide is something I put together to really conceptualize the evolutionary change that we've all likely witnessed or at least remember, and what it could have been if it was revolutionary. Let's start with number one. If a child is not having their needs met by their parents, let's provide help. And if that does not make a sustainable difference, let's plan and place the child in a different, loving, and safe home. That's evolutionary change. That was what? The Fleming rule that we just talked about. Because there was arbitrary dismissal of families from ADC, policies evolved into the Fleming rule. Let's think about what this could have been if it was revolutionary. Our child welfare system and our communities need built-in safety nets for families. We need to engage in advocacy for a reinvestment into communities so that the well-being and safety of children can be facilitated by families and communities and not state-sanctioned intervention. Again, nothing inherently wrong with this evolutionary position, but look at what it could have been if we had that type of mindset. Okay? The next one is the world is changing. We need to diversify our staff. Sounds very familiar. This is what it could have been, or what it can be if we continue to be revolutionary. We know that diversity is not enough. We must remove oppressive requirements and policies and microaggressions and barriers to promotion, etc. So when we're thinking about our workforce and our organizations and making them diverse, we also have to have a revolutionary hat and think about going a bit deeper. The next one says, we need to recruit more foster parents to meet the needs of families in our communities. Nothing wrong with that. It's evolutionary. It's supply versus demand, right? We need more foster parents. Let's create campaigns to bring them in. But let's think about from a revolutionary standpoint, the foster parent conversation. We need to facilitate the cultivation of strong communities and families who engage in informal kinship practices, thereby making foster care obsolete. That doesn't always sit well with folks. And I get the same question every time. Will we need foster care sometimes? And my answer is yes. We may have the need for some resource families, some foster families. But if we really reorient ourselves to changing how we do our work, primary prevention, supporting families, we won't need as many foster parents as we do today. Another one here is our parenting classes need evidence-based curriculum. So I've been in the field and I've assigned parenting courses to parents. It's really one of those de facto default requirements. But then evolutionary change happened where they required these parenting courses to be evidence-based, to have some level of effectiveness and satisfaction, which is a good idea. But let's think about if we pushed it further. The arbitrary assigning of parenting courses for families should be eliminated. This requirement insinuates that there is a universal dominant way to parent. It also promotes conformity and assimilation. I want you to consider that. Are these parenting issues, or is there a deeper issue that we're putting a Band-Aid on by sending people to parenting classes? So the arbitrary assigning of parenting courses in a revolutionary way should not be our default. The next one says, let's incentivize working. So any parents who receive assistance need to have a steady job within a certain time frame. And we sort of just touched on this because it sounds a lot like TANF. But what could this have meant if we really thought about it from a revolutionary position? Let's advocate for the creation of affordable college, trade schools, jobs which pay a living wage so that parents can work and make enough money to take care of their families. We want parents to be able to have a job that helps them operate their homes, not decide they shouldn't work because of low wages. The next one says, once a child is removed, we need to expedite their services, getting them the mental health care and medical care they need. I don't think any one of us think anything is wrong with that statement. But let's push the needle a bit in a revolutionary way. On the right side, it says, foster care should not be the pathway for needed services for families. These services should be accessible and known barriers removed. So although evolutionary change was, if a child's in the system, let's get them in to see a physician, get them a counselor. But now we're saying, what about revolutionizing how we have this access before they ever encounter our system? And the last one here says we need a clear path to permanency for children. So let's work on termination of parental rights to make them smoother. And a revolutionary position is arbitrary timelines to terminate parental rights should be completely eliminated. So I say that, and I'll end this segment by saying the decision to separate a child from their family legally should not be based on timelines. And I know that timelines are relatively important because of the court system and things like that, but I have been in Zoom calls with the judiciary and judges and attorneys, and we've tried to re-envision how we could go about doing this work and not being impacted so heavily by timelines and things like that. I want you to consider if you have any questions about this as we move on, because I know that usually I stop throughout for questions. So if anything comes up as you're listening, feel free to put it in the chat or write it down, and we'll save some time at the end. Let's talk about some definitions and current trends. So nationally, the number of children in foster care at the end of the fiscal year in 2010 was 407,454. Okay. 8 years later, it went to 435,052, over 25,000 increase kids in foster care. Okay. Kids entering foster care also increased in that 8 years. However, the number of kids exiting foster care actually decreased in that same time frame. I highlight this because, again, quite like the 1930 statement from the White House, in the next 8 years, I think we don't want to see more kids coming in foster care, more kids sitting in foster care, and less kids leaving foster care. But these are some trends that have happened in our country. More data trends. Generally, in foster care, Black children take up 28% of the kids, but they are roughly 14% of our general population. Another statistic is 40% of those Black kids in foster care experience placement stability. So when they get into a placement, they're often moved to another one. The latest data from HHS from 2018 found that 61%, over half of the cases that our system gets in this country, are due to neglect only. And when I say neglect only, I'm not minimizing neglect, but I just want to make it clear that families are struggling through material and financial need. Neglect, by definition, is the inability to provide housing and medical care and food for someone's child. And we have to really understand and really demystify the confusion that neglect and poverty equal bad parenting. We've heard these words before, some definitions. Disparity is that unequal treatment and decision-making based on the color of one's skin or classism or sexism. There's disparity out there. Disproportionality is when a certain amount of a subgroup might be sitting in foster care or sitting in your criminal justice system, and it's disproportionate from how they show up in the regular population. Now, what does research say about why this is happening? Let's take a few moments to look at what research says. One of the reasons it happens, research says, is socioeconomic factors. So poverty isn't the entire reason, but poverty is a determining factor. It really impacts how the numbers of Black and brown kids are coming into our system, which makes a lot of sense now that we know that over 60% of them are struggling through neglect and likely poverty issues. Research also points to visibility bias. And what we mean by that is we do a really good job of trying to send families into the community to get help. Help with income security, help with food insecurity, to help with trying to find a job, to help with getting therapeutic and mental health services. But we're also sending them into the community and among other mandated reporters. And often when we do a good job of connecting families to community resources, cases go up because these mandated reporters are calling in to the child abuse registry. Visibility bias. Dr. Dorothy Roberts calls it an over-surveillance of these vulnerable families. That is driving some of the numbers of Black and brown kids coming into our system. Another reason that's showing up in the research is geographic context. Depending on if you live in a rural area or if you live in a densely populated metropolitan area, like LA County, New York City, Chicago, Minneapolis, it makes a difference regarding how many kids are coming into our system. And lastly here, research also has illuminated the impact of implicit bias, which is defined as this automatic system that lives in each and every one of us that impacts our decisions because of our values and what we see in the media and how we view others. This next picture might look familiar to you. It's a picture of the doll test. It was done by Dr. Kenneth and Mamie Clark in the 1940s. And really, it was one of the earliest and most profound displays of implicit bias research, where they put these two dolls and they look identical, except the color of their skin. And they had children sit in the chair. As you can see, that child is mixed race, but they put Black kids in the chair and white kids in the chair. And they ask a series of questions like, which doll is pretty? Which doll is mean? Which doll is scary? And they analyzed these questions child after child after child. And they realized that for the majority of the questions that had a negative connotation, the child often chose the Black doll. Questions like, which doll is ugly? Which doll is scary? Which doll is mean? I bring this up to say the importance of vilifying the bias and not the person, because I don't think anyone in this webinar is upset with that child. I know I'm certainly not. But when people say there is no implicit bias in criminal justice, and there's no implicit bias in healthcare, and there's no implicit bias in child welfare, I say, if a child who's 5 or 6 has already developed some level of preference and bias, surely we can as professional adults. The next thing I want to hit on is power and privilege. So consider the work that you do and the organizations that you work for. And we'll start by looking at hierarchical and imbalanced organizations. They usually have this mode of reward versus coercive power. For example, in CPS, sometimes we hear things like, if you do X, Y, and Z, you'll be able to visit your children. If you do X, Y, and Z, we'll work towards reunification. It's that reward power. That's a structure that is hierarchical, and there's an imbalance. They also use coercive power, quite the opposite. If you don't do X, Y, and Z, you will not have visitation with your kids. So again, this type of power structure often uses rewards and coercion to get what they want done. Subjugated populations, also known as oppressed or powerless populations, have some pretty normal and expected pattern responses. One of them is conformity, also known as adherence. I've had clients like this, perhaps you have as well. Clients that do whatever you ask them to do. You have to do this class, take this course, do this to get your kids back. They do every single thing without fail, without uttering a word. Some folks think that's great, right? They're doing what we ask them to do. But we don't want to be dictators. We don't want it to be a checkbox type of system, because that doesn't elicit sustainable differences in behavioral change. Another response is fight, resistance. These are the parents that argue you tooth and nail, that push back all the time. We've had parents like that. We've had clients like that. We've had kids like that. Okay? We also write that up in case notes sometimes. If parent is uncooperative, parent refuses to cooperate. But we have to remind ourselves of how we showed up, that we show up in this hierarchical power structure. Did we not share power at all? Because if we didn't, their response is pretty normal and expected. Another response, flight, also known as absence. Physically not being there, maybe parents not meeting you for a meeting, parents not showing up to court hearings, but also mentally checking out. Folks that work with kids one-on-one. Sometimes you have a child in front of you and they're not listening at all and you're trying to get through them, but they've already checked out. They've already become absent. And if you don't know why, consider how you showed up. Consider how many other dominant structures that child or that parent has dealt with. When you feel powerless, there are normal, natural responses. I want you to ask yourself how you respond to feelings of powerlessness. Okay? This is going to be one of our polls. So if you can pull out your cell phone, you can go to menti.com. It's MENTI.com. And at the top of it, you'll see a code. I'll read the code out in case it's helpful. But you'll see your question and feel free to send in how you respond personally when you feel powerless. It's 8318113. How do you respond personally to feelings of powerlessness? This is anonymous. You can let us know how you respond. I can't take this poll, but if I did, I would be in the conform category. I usually just try to keep my head down if I feel I'm up against a dominant structure, and I just try to get it done, whatever that may be. A lot of people are coming in with conformity and fight, and this is quite normal and what I see when I do these polls. Conformity, we're at 21. So I want you to be looking up at these results and ask yourself, is that what you expected? Is anything shocking about it? As you also consider your personal response to powerlessness, I hope that it brings about some level of empathy with the clients that we work with, or with someone who you dealt with that had a response that made you feel uncomfortable and made you feel angry, or when somebody had rage and you blamed them instead of looking back at our system and how we showed up. All right. Thank you so much for taking that poll. And a few more are coming in. Thank you. Thank you. Conformity is still the most. You are welcome to continue to send that in because I will get the report of what we got on that. The next power structure that we can talk through is negotiated and reciprocal power. Okay? We talked about hierarchical, but in my experience, lots of organizations are right here in the middle. They try to share some power. It's considered a mediator. The holder of the power grants access, but it's not consistent. The authority provides the subjugated with certain opportunities to make decisions, but they're going to continue to hold and wield the majority of the power. Lots of organizations are right in between these two, okay? Trying to make the leap over to shared balance of power. It's consistent and it's equitable. You see yourself as a facilitator and a resource to families, walking alongside them and their participant-driven goals. Focuses on client strength, building collaborative relationships, co-creating solutions, and addressing challenges that come up together. Ask yourself where you are in these pillars of power dynamics. Some folks realize that their organization might be between hierarchical and negotiated, but they're over here in the shared balance. And how do you manage that when you're trying to share power, but the literal powers that be are not trying to share power? It makes for a tough and complex way of doing work. But I hope that this gets you to thinking about how you show up and also how you advocate for new ways of work. This lends itself to a conversation now about privilege. So we've talked about power, but privilege is also, very connected. This is Dr. Kenneth Hardy and his framework, tasks of the privileged and tasks of the subjugated, tangible, plausible, feasible things that you can do if you associate with the privileged or the subjugated. Okay? For example, if you identify with having privilege, the first thing or first task is to resist the false notion of equality. It is not helpful to equate suffering. An example is when someone says Black Lives Matter, equating suffering is you saying all lives matter. Another task of the privileged, intention versus consequences. I know I'm guilty of this, and many of you may have used the terms or the statements, I didn't mean for that to happen. I've said that a lot. But it is not helpful to continue to clarify intentions if the consequences were harmful. Let's think about those policies and the evolution of policy and how I think people that wrote policy did it with the best of intentions. But now that we see that some policies are hurting certain subgroups, it's time for us to talk about the harm and not the intent. The next one is challenge the ahistorical approach to our work, because history matters. And that's why I always try to start with some historical context. Okay? So again, if you identify with the privileged, try your best not to dismiss the past as if it's not informing some of the things that are happening today. The last one on this list, persevere. Don't give up on building relationships with people who are subjugated, even if initially rebuffed. Tasks of the subjugated. There are things for the subjugated to do too. One of them is overcome learned voicelessness. You must advocate for yourself. Reject the notion that silence is golden. As easy as it might be, or as comfortable as it feels to conform and not speak up, a task for you is to speak up. Advocate for yourself. The next one, overcome the addiction to protect the privileged. Pre-COVID, we were usually in rooms together, being trained and learning from each other. And I recall being in a training and there was a woman in the room, she was Caucasian, and she started to really feel emotional. And she felt shame and guilt as we were talking through some tough stuff, some anti-racism and systemic racism type topics. Some of the oppressed folks or subjugated folks or minority folks in the room wanted to take that moment away from her and make her feel better. It's not that bad, don't worry about it, or the things that they said. But we can't protect the privileged from going through a very normal and natural experience, because on the other side of that shame and guilt is allyship. Below that is we have to deal with our own rage and channel it appropriately. Because just like shame, as Dr. Kenneth Hardy culminates, shame is a major stumbling block for the privileged, and rage is a major stumbling block for the subjugated. Both are very normal and natural, but they have to be managed. All right, so now we're going to shift over to our mindsets. Who are you? What are the organizations you work for? The first mindset we'll talk through is segregationist. They believe these people cannot be helped. And these people, as in the families that we're serving, the youth that we serve. A segregationist believes we must save them from themselves. A segregationist is punitive, blames. They believe these folks are permanently inferior. Some of you might be thinking, well, we certainly don't have any segregationists working with us or any segregationist-minded organizations, but we do. The next column is assimilationist. In my opinion, many of us probably can associate with this one. Many of our training curriculums and university courses and things like that, they train us to be assimilationists. Although a segregationist believes these people cannot be helped, we believe they can be helped. We can help them become more civilized. We can help them become more educated. There's often a standard of whiteness that we're trying to bring these families up to reach. Although a segregationist blames, we save, because we only think they're temporarily inferior. This might be a hard pill to swallow, to think through our own mindset. But I know you've heard people say, I've come into social work, I've come into criminal justice to help save kids. You know, we have this savior mentality. Okay. Many people are trying to make this shift over to anti-racism. Some people call it, you know, an abolitionist. A segregationist believes these people cannot be helped. Many of us believe these people can be helped, but an anti-racist believes these people are people. They're already civilized. They're inherently valuable. An anti-racist focuses on reducing inequity and creating equal opportunities. And a segregationist blames, we come in to save, but an anti-racist liberates. Because families were never inferior to an anti-racist. They want to liberate families from oppressive systems, liberate families from oppressive, powerful structures. Okay? Who are you? I want you to consider that. I want you to consider who you work for. You know, is your organization segregationist? Are they assimilationists? Are they, you know, a combination of a couple of these? The feedback I get from folks that go through this is the jump from assimilationist to anti-racist is proving to be a tough one because we're so indoctrinated with coming in, saving, civilizing, educating. Okay. So we've heard, again, these terms, racist and anti-racism, you know, based on Dr. Kendi's theory of anti-racism. Some definitions we'll go through. Keep that mindset in the back of your mind, though. So racist, the support for racist policies, procedures through action or inaction. And anti-racism, quite the opposite. Anti-racist policies through action or advocacy. And by now we know that being not racist is just not enough. It's a very neutral and indifferent, very status quo position. And we're all pushing ourselves and challenging our organizations to become anti-racist. Racist policies are legislation or organizational procedures which produce or sustain inequity. But anti-racist policies sustain and produce equity. People often ask, well, how do we even begin to build an anti-racist system of care for families? And I say, based on this theory, it's going to become extremely important that we consider this term descriptive instead of pejorative. And I realize that since time immemorial, people are highly offended by the term racist. It's very pejorative. They feel like it is an affront. But I challenge each of you to try your best to talk about this in a descriptive way based on these definitions. I have a couple of things to offer up as conversation starters that I hope are helpful in your everyday work or even in the learning exchanges that you will do in connection to this webinar. All right. So the first one is a statement that says, this policy does not impact all the families the same. I'm advocating for an exception for this family, and I'd also like to review this policy as an agency because it negatively impacts Black families. I can take the lead on convening a work group for review. So this position is someone who is noticing that a policy is promoting inequity, is impacting a certain subgroup more negatively than another one. By definition, that is a racist policy. And they're speaking up about it, trying to explain why they feel the way they feel. I tell folks all the time, I have a little bit of clause that I offer up before I give a critique. Sometimes I say, I know normally the word racist is usually really offensive, but the way in which I'm about to use it is purely descriptive. So that's my hack. That's how I get in the door to say, this is what I want to critique, but I give them a heads up that I'm being descriptive. Another option here, if it starts to give you an idea if you want to speak up, it says, I've noticed a pattern in our court hearings with Black parents. They rarely have adequate representation, which creates a power differential that will almost certainly lend itself to their disadvantage. That's someone speaking up about the court process. It's not an easy thing. That's why these are courageous conversations. Another one here says, I hear your position on this family. Can you tell me more about why you felt differently with the Ross family from last week? These families are very similar besides their ethnic background. Again, that's something bold, right? But something necessary. That is a statement you might make to a colleague that you've observed disparity in a decision. Another one, for example, a therapist might consider, because therapists often ask me, how do I bring in this topic in therapeutic settings? Okay. This is something that they might say to a client, particularly a client who's a youth. There is so much going on in our country right now, and much of it is about racial tension. What parts have you been paying attention to? Or what from the media has been on your mind? And these might sound simple enough, but a lot of therapists that I know steer clear of things about racial unrest. So these are just topics and ways to open up the conversation, especially if you're working with a youth of color. I also get questions from foster parents and adoptive parents who are committed to creating an anti-racist home environment for these kids they're bringing in their homes. A foster parent or adoptive parent could use this. Can you tell me more about a time where you felt the most seen and where you felt your voice was valued? I'd like to do my best to create a space where that continues to happen. And lastly, it says down here, this African-American mother has been trying to secure housing for her children for the past year. She has moved 3 times due to restrictions of time in affordable housing apartment units. We threatening to take her children is cruel. Let's figure out another way. This is standing up for a family that you see is clearly struggling. So if you've heard me speak before, any of you, I usually end with the same quote, and I'll end today with the best time to plant a tree was 20 years ago, but the next best time is right now. So that's why I want to leave with you the idea of let's start planting today a system that is more equitable and more safe, and that truly strengthens families, in particular families who are at multiple intersections of inequity. I'm going to stop share and happy to take any questions you might have.
Thank you so much, Dr. Pryce, for that information. And so what we're going to do is we are going to go ahead and have folks put into the chat their questions. We had a few that had been put in there. So I'd like to read the first one from Jessica Watts. How do we get past the assimilation fatigue? Like, how do we deal with trying to shift our organizations to move from assimilation?
So the advice that I give when I get this question, because I get it often, because we're really stuck in that realm, is find your people. Find colleagues and your peers who think like you. Because as I often say, we are the system. So if we want to change the system and transform the system, it's going to require us moving in numbers. So I say, get people that are like-minded and start to, again, build a community around this language, around this mindset, and then go to supervisors, go to managers, and talk about what you're seeing. Tell the story. I say there's power in storytelling. Tell stories of how you have changed the way you approach work. You are being anti-racist. You are sharing power, and it's impacting families in this way and that way and this story. And that's how you slowly start to bring others on board. So I say, find your people, find your community, and start telling stories of how this new way of work is impacting families and also how it impacts you. Because I have a heart for the workforce, and I know how hard it must be.
Right. So our next question is from Liza Davis. Liza asks, could you please share your thoughts on the collaboration between child welfare and the police? How do we frame that conversation and explain it to people who might not understand how these two systems interact?
Well, I'll say this. I will say that I did a training about a year ago where it was very much different people in the room, where there were educators, as I said earlier, and social workers and child protective service workers and the chief of police and some of his deputies. And I was really amazed by how they were all coming together to say, we need to think about anti-racism and try to figure this out together. So my initial thoughts about it is, I think there should be more collaboration, but people need to be on the same page. And when you explain the connection between law enforcement and child welfare, I think it's going to be important to disaggregate, if you may, or disassemble this idea that neglect is egregious abuse. There might be some occasions where law enforcement is needed, but in my professional opinion, law enforcement isn't needed with a family that's struggling through financial need and needing community resources. Someone who is dealing with trauma and addiction and mental health. Those are things that should be handled by someone that has specialized skill and different information at their disposal. So that's my thought about law enforcement. Collaborate, be on the same page when it's feasible and relevant and appropriate.
Great, thank you so much. All right. And then if anyone wants to unmute, or I think you can unmute yourself to ask a question, please feel free to raise your hand or type in the chat so that we can unmute you. And then there's a question on any thoughts on an alternative to child welfare.
Yeah, I don't know exactly what you mean by that, but I will speak to this idea that there are conversations right now that say, should child welfare be investigating and be addressing issues of neglect? You know, things like that. Should that be going through to a completely different system? Because the idea of investigating a family that is dealing with protracted poverty doesn't sit well with some of our leaders anymore. So there are lots of conversations about alternatives to this child welfare investigative system. And the second thing I'll say is we are trying our best to speak a different language around reinvesting of resources into communities so that those communities can in turn reinvest that money into biological families, strengthening families so parents can take care of their own children. So there are conversations about alternatives to traditional child welfare. Thank you for that question. It's extremely important.
Along those lines, Dr. Pryce, can you briefly talk about the blind removal meetings that you participate in?
So when I was in New York a few years ago, I was responsible for coming into Nassau County after they had been implementing a pilot for a number of years. It was my job to really see how blind removals had impacted the organization. So I did focus groups and interviews with frontline workers, their supervisors, their managers, their directors, all the way up to the commissioner to really learn all of the other community-oriented efforts they had made, but also what blind removals had really done to their discussion around families. And as many of you know, blind removals is a practice where they have blind removal committee meetings and they talk about cases, but they don't bring up ethnic background, neighborhoods where they live, immigration status, language barriers, anything like that they leave out. They focus on what happened, parent capacity to protect and resilience, and also relevant history. And with that information, there's a decision made whether or not the child is removed from the family. I learned so many things from the caseworkers during my study. Caseworkers said they had never thought about it, but when they saw a certain address or a certain neighborhood, they did have a certain disposition. They did kind of have their mind made up. So blind removals did impact their decision-making, and it really gave them keen awareness of implicit bias.
Thank you so much, Dr. Pryce. I'm going to jump in here. We have a few more questions, and I do see a hand raised, so maybe we'll go with that. Rosie,
Hi.
you have your hand raised? Awesome.
I do. Can you hear me?
Yes.
Wonderful. So my question is this. I've had this, this thought for a couple of years now, and whenever I brought it up to people that could possibly make it happen, they always tell me, this is not something that can happen because of all the barriers that there would be and all us being mandated reporters. So my thought was that why not, instead of going into a home to investigate an abuse case, why not have like a hotline where parents can call when they're feeling stressed out, when they're feeling like, you know, I've had enough, I cannot handle this anymore. I need help, right? Isn't it possible that we can create a system where we can pick up the phone and say, can someone come and give me a break, right? Because in our area, I live in the Antelope Valley in LA County, and we've had several high profile child abuse death cases. And so I'm thinking to myself, why wasn't there any support there? Why weren't we able to help them before the tragedy happened? And I'm thinking, it's possible. Why can't we just say, I'll come out and I'll see what's going on with you, give you a break. But everybody tells me no, because the reporting system will get in the way. And I even came up with a jingle, all kinds of stuff, because it was so important to me. But everybody tells me, no, this cannot be done. And I'm thinking, this is, when you were talking about revolutionary, I thought that was revolutionary because nobody else is going to do it and nobody's going to take the repercussions in case something was to happen. So do you think that it's possible? Is there a way that we can change the way we view things and make something like this possible?
First of all, thank you for sharing. And I hear how committed and passionate you are about that idea. And I share your commitment and passion. And when I say things like reinvesting resources into the community, I am speaking your language, because we want communities to be so strong and so resourced that when a family needs help, they can call an agency or an entity or a faith-based organization in their community to get the help they need. So I know you categorize it as calling a hotline, but kind of we're conceptualizing it as building community resources right there. So folks don't have to call us. They can call someone that knows them, knows their family, knows their children. So I agree with you. And I know you asked me, do I think it's possible? I'm a revolutionary. So my answer is yes. But we have to continue to find our people, find our community, keep talking, keep sharing stories, keep doing what you're doing, talking about this new way of work, this new way of helping families in need.
All right. Sorry, go ahead, Troy.
No, thank you so much, Rosie. I just wanted to echo the revolutionary concept. If we can think about it, we can do it, right? Maybe we'll get some young students on something like that. That's a fabulous idea. I was looking through the questions and there are a few more, and if we don't get to them, which I think we will, maybe we'll give them to Dr. Pryce and then publish them. One thing that came up a few times, and I had this question as well, any frameworks or models that either you've encountered, you've written, you could recommend for these courageous conversations, or just this journey, or just, I know here at Strategies TA, we've subscribed to Cultural Proficiency with Kakanza Nuri Robbins and done some training with that. And we use that at times as one of our models. Do you have any recommendations? And there are a few people who have asked that.
So I can talk about a project that we just did where we pulled together folks that have been doing this work in child welfare, this work of anti-racism, long before the murder of George Floyd. So we brought them together and we did interviews and we read their policies and we learned from them about what they're doing and what they have been doing, really a process understanding of how did you get started? What were your pitfalls? What were your barriers? You know, what did the community say? You know, how did you do this with funding? And we have a really good sense of how they're doing anti-racism work. And we're trying to actually put together a framework. And I believe that I'll be doing another webinar with your group. I don't remember if it's next month or the month after, but I'm going to work really hard to be able to report out from that project to give you an idea of how that framework is being pulled together.
Awesome. And we anticipate that.
We're looking forward to that. And it is April 15th from 2 to 3:30. So Jennifer Kuo has a question. You mentioned earlier about parenting and evidence-based practices. Are there ones that are more inclusive and culturally competent?
So not to my knowledge, at least when I was in the field, they were pretty cookie cutter. And I think that that has been a tough area for child welfare, to really be able to approach parenting with a level of cultural sensitivity and humility. Because again, if you're not being intentional about that, you do have this aura of assimilation and conformity and dominance, that dominant way of parenting. So I would answer by saying it needs improvement. And I think that it depends on the instructors and the folks that are trying to train and how they facilitate. But the content, it would need some improvement around a level of diversity and cultural humility and really inclusion, and also not being heteronormative. I think child welfare has a long way to go to incorporating LGBTQ perspectives and families and family makeup.
Yeah, that's great. I actually worked in a really diverse community that did parent education, and we actually had to develop our own curriculum because it just was the ones that out there are just based on heteronormative families. So yeah, we have someone who wants to ask a question, Rachel Averbeck. So you can go ahead. Let's see, Rachel.
Hi there. Can you hear me all right?
Yeah, great. Thank you. Go ahead.
Super. So I'm a CASA, and one of the things I hear frequently and understand completely is constant apologizing. I'm so sorry, we don't have enough, we don't have as many social workers as we used to. They're completely strapped. They're all overworked. And so as you're speaking, I'm noticing the Obamas behind you, and I'm thinking about what you'd like to share with us around how we should engage to shift policy and funding so that the apology isn't the normal answer to solutions not happening. Instead, our inability to step up is the answer, right? To something not happening. And so I'm curious what's happening in Washington and also at the state, and what the lobby for the reallocation of funding is. Like, what's the experience in Washington or at the state on that?
So I think I can offer up some information on that based on a new initiative through the Children's Bureau called Thriving Families. They're about to do a 5-year pilot where they choose thriving family regions around the country. And they are going to pilot test this idea of reallocating funding to the right before the front door with primary prevention, trying to help communities become stronger, help families have the resources they need before they come into our system. That is one initiative that I encourage you to look up. Again, it's called Thriving Families. And I think that that is a good way to at least start. I'm glad they're doing that. And at least they'll be able to collect some data on how important and how impactful that will be. I'm a huge policy person. I have colleagues that say, oh, we can't focus on policy because policy takes a while. As we know, some policy being written and legislated, there is a process. And I have some colleagues that feel we can do this on the ground. We can be community oriented. We can change the face of child welfare, without waiting on the federal government. But I lean on Dr. King's quote, where he said, policy cannot change the heart, but it can restrain the heartless. So I advocate for equitable policies. I'm an advocate for legislating equity across the board at the federal level and state level. And I do believe that once Thriving Families is off the ground, we'll be able to see how impactful it is to reinvest an adequate amount of money into certain communities and see how that really diverts families from our system. I appreciate your question. I also want to touch on, I think I heard you say, how do we play a part in that? What can you do? As someone who works with legislators in my home state, Florida, it does take a while. It does take a lot of maneuvering, but again, I'm going to lean back on the storytelling. Tell your stories. Find folks that are researching. Some legislators are pretty data driven, at least the ones here in Florida are. They want to see numbers. They want to hear, and they want qualitative data as well as quantitative data. They want to know what's happening on the ground. And that's our job here at the Institute that I lead. We let them know what we're finding as it relates to research and evaluation, and they legislate according to that. So I know that we're not professional lobbyists and we don't work 100% of our time trying to advocate for policy change, but we can do our part with storytelling and networking and trying to make sure people understand what's really going on.
Thank you. I hear that as a call for me to write letters to my representatives sharing my experience as a CASA. Thank you. That's super specific. I appreciate it.
I was going to say, now you can email your congressperson or your state representative. So there's much easier ways to do it. One quick question was from Christina Losco. How do you get the community involved in equitable child welfare, child abuse prevention practices that go beyond services and into systems thinking?
So you cut out a little bit and it might be my internet, but I did hear you. How do we get the community involved? And I think that's the last thing I heard. So
just how do we engage the community in thinking about equitable child welfare and child abuse prevention, but beyond service, more in the systems change?
Yeah, well, I'll let you know about a project we did here in Florida. It's called CPAR, Community Participatory Action Research. And we wanted to hear from our community members, in particular, those that had gone through the child welfare system, so those with lived experience. We brought them on into a group called the VIP, Very Important Parents. And these parents, some of them had lost their kids permanently through TPR. Some had their kids in foster care. And we brought them on as co-researchers to partner with us to really help us with systems change. So we asked questions, what can we do? What can we recommend? Our mentality is no more research about us without us. So we want to hear from the community. So my number one thing is going to say, the way to advocate and bring in the community is to listen to them and invite them to the table. I also want to say that you have to have a level of flexibility and perseverance. We talked about that, actions of the privileged when you're working with families that have been harmed by our system. And we have to have a level of humility and hear them out. But we don't have to guess how to change our system. We don't have to guess what to do next as it relates to transformation. We can ask the community. We can ask them to weigh in. And we are doing that in Florida.
Thank you so much. I know there's so much national conversation around the lived experience and how that can influence decision and policy making. So I think that we need to continue that. Do we have any other questions for Dr. Pryce?
Hey, Dr. Pryce, something that came across my desk. Just some tips on having the conversation when you get a rebuttal from someone about the word privilege. Like when someone, kind of like the example that you used when you talked about the person in your training that was going through their emotions and things like that. But I've gotten a few questions from folks in dialogues about, when I bring up privilege or white privilege or things like that, I get such pushback, and then they go into that category of I'm just going to be complacent about it and not talk. Do you have any tips for that type of conversation?
Yeah, the one tip that I'll lean back on is to try to use my hack where I think people start to push back and those rebuttals because of offense. They feel some level of offensive and they feel that they're being called out. And it's okay to call people out, but I would tell people, let's have an intellectual conversation about how this policy or how your behavior or how your decisions are impacting the families that we're all being paid to serve. So I tell, that's how you really are being clear. It's we're here to do a job, to help families, to bring justice, to bring equity. And in a very descriptive manner, let's talk about what our behaviors and what our decisions are meaning for families. That's not going to rectify everything you're talking about, Troy. I think that those courageous conversations are sometimes extremely difficult. And sometimes these discussions happen and you never want to have them again. But I say persevere, try again. And people that are serious about the work of equity, they will come back and they will want to talk to you.
Great advice. Thank you.
So we had one question, Dr. From Katie Joe. I hope I'm pronouncing that correctly. Dr. Pryce, do you have thoughts or tips on how lawyers might bring some of these courageous conversations into the courtroom, especially when courts tend to view the legal system as being colorblind and it isn't really open to believing that race is a relevant legal factor?
Yeah. So I did a training recently with all attorneys and all judges. So it was really interesting. And when we got on that power piece, which lends itself to courageous conversations about the power that is wielded through the court system, a judge, raised their hand or unmuted and said, well, how do I share power when I'm literally sitting on a bench higher than everyone else, wearing a robe? How do I share power if that is what we're looking at? And it was really great because for the next, 10, 15 minutes, we were able to re-envision what the judiciary could really be as it relates to families. Should we be in a courtroom with a person on a bench, handing down a ruling about parenting, about parents in crisis, about a parent that might be struggling through addiction and protracted poverty? Do we need someone on a bench doing that? And some of the judges had to say, I don't think we do. So really, I think there's also a conversation of how to reimagine how we do court hearings and proceedings, how attorneys go about their job. So when you ask the question of how to bring that into an attorney or a judge or that judiciary system, I would say, are we doing enough to share power? Do we have to, these are questions I would ask. Do we have to have this hearing in this courtroom? I used to do this work. We didn't do every hearing in a courtroom, especially the hearings that happen on the weekends because of emergency cases. So there are ways around the traditional monarchy that I feel like we've kind of upheld in our system. So there's ways around it. And there are attorneys and judges that are pushing and prodding at the status quo to change the appearance of what goes on in these court hearings.
Thank you. That was a great question. I think it's also just a reminder of, how do we have, in order for us to change systems, we have to think outside the box, because currently what is in place is unfortunately embedded in racism. So we need to really rethink that, the whole system. So yeah, it's a great point. All right. Well, thank you so much for all of your thoughtful questions. Thank you so much for your time today, Dr. Pryce. We feel so honored for you to be available to us to share all of this really rich information. I wanted to remind everyone that Dr. Pryce's webinar will be on our YouTube channel, Strategies TA, so you can search for that. After this, you will receive a SurveyMonkey link, and actually we'll post that in the chat. So if everyone could please fill that out to let us know how we did. This helps us continually grow and improve our content. And also, if you're interested in joining the Equity Learning Exchange cohort, I will be facilitating that, and we will be going deeper into this topic of equity. That will be determined by you all, whoever would like to join. So I'm really looking forward to that. And then also just keeping following us for great content on our YouTube channel, but also keep in touch with us. Please visit our website at www.strategiesca.org and sign up for our mailing list so that you can be apprised of all of the great events and offerings that we have. And you can also follow us on Facebook, Strategies TA, as well as LinkedIn. So once again, I want to just thank Dr. Pryce again for her sharing so much really valuable and information and helping us get this conversation started around equity in our systems. I just wanted to let everybody know again that this will be on our YouTube channel. And please, if you can, complete that survey in the Survey Monkey in the chat. You will also get a follow-up email that will have that survey link again in case you can't do it right now, as well as the link to the YouTube in case you wanted to have that available. So thank you all for joining us this afternoon and for your time. We appreciate it. Thank you for your thoughtful questions and your interaction. And we hope to see you again soon. I did want to just let you know that we have a webinar coming up on March 30 with 90 by 30 from the University of Oregon. They provide child abuse prevention support to rural communities in Oregon, and we'll be sharing some of the strategies that they use in child abuse prevention. And also Dr. Pryce will be back with us on April 15th from 2 to 3:30. So again, please check our website for the information on how to register. So thank you all.